What's popping? What's popping? Welcome back to Pop Health. Today we're going to be going over Dr. Mike's video with Jubilee on anti-vaxxers. Now, this is a hotly discussed topic, especially as of right now. We are going through a measles outbreak here in West Texas. That is the biggest one that the U.S. has seen in a while. And so vaccination is on everybody's mind, especially here across the nation and stuff. So definitely this is a topic that we're going to discuss, and I'm going to debunk from my public health standpoint.
And I've also had a friend who I went on a mission trip with, and this pastor was totally healthy, two young girls, and this pastor literally got a heart attack out of nowhere. And the only thing was he took the vaccine. And there's many cases like that.
Well, okay, so here's the thing with this argument. Basically, a lot of people are assigning that when people have adverse health events, especially after taking the vaccination or vaccines, they tend to blame the vaccines because otherwise the person might be healthy. Like, for example, I had a old high school teacher that said his neighbor had a heart attack. Ultimately, healthy dude, like, you know, was eating relatively well. Fruits, veggies, stuff, the whole nine every day, no processed foods, or kept at a bare minimum, and he just had a heart attack. And the thing with that is heart attacks are not just due to lifestyle choices. Heart attacks just happen when they just happen, but it's not due to just a certain, just one certain thing. It's a multiple life events as well as just luck. But when the thing is, when people are saying, oh, young athletes are passing out, falling out, oh, this college student passed out, passed away, as well as just seemingly healthy adults start doing this, they often sign into the vaccine when there's no correlation, or there's a correlation, but it's not necessarily causation.
Mm-hmm. So when we see two things happen simultaneously in healthcare, sometimes we think they have caused one another. But unless we see a pattern of that happening over and over again on a large scale,
right,
it's more likely that this is just a coincidence of things happening at the same time.
And we haven't seen that pattern on a scale, at least to scientific, you know, enough to get science involved with it. So we'll just keep that in mind.
For example, I have a friend of mine who's a physician who vaccinates children very regularly. And they were about to give a child the vaccine. And before giving the vaccine, the child had a seizure.
Yep.
They went on and had more seizures throughout their life and ended up actually dying at a very young age because of a seizure disorder. But the vaccine was never given. Had that happened 2 minutes later, what do you think would have been in the mother's mind and in the father's mind in that situation? Other than, I definitely think that vaccine caused that problem. But it could just as easily happen before, which it did, and the vaccine wasn't responsible. So it's very difficult when two things happen at the same time to be able to make an exact reason as to if that's what.
So seeing, you know, how Dr. Fauci, who was just pardoned, and that's a whole other discussion.
As he should be
seeing how,
pardoned.
Like, we were sold a bill of goods that we, the American tax dollars, paid for, while these pharmaceutical companies reaped millions and millions of profits on. I think that caused the goalpost. Oh, the vaccine, this mRNA vaccine, it's going to prevent the transmission of COVID. It's going to prevent you from getting it. And others, if you don't get this vaccine, you hate your grandmother. You're going to kill all these people, and you got to do your duty and get it. Well, you know what? My grandmother got it, and she died. I saw her take her last breath.
I'm sorry.
And it's a very it's a very profound thing to see someone that you love take their last breath and go on to whatever happens after.
So I want to say she touched on several points. One, Big Pharma did take advantage of it. Don't get me wrong. But Big Pharma takes advantage of every little thing, like cancer. Cancer is a real thing. Like, let's just not forget, cancer is a real thing. Like, I've had family members that passed away due to cancer. I've had grandma survive breast cancer twice. Cancer is a real thing. And yes, cancer is also very expensive due to Big Pharma. Now, am I into that whole club where I think there is a conspiracy where they have the cure for cancer and then basically they're hiding it from us? No. But I'm also in the club of just like understanding that, you know, when there's a real health threat, like with the COVID-19 pandemic and, you know, with, you know, cancer, just all these chronic illnesses and all that, and infectious diseases, people are going to come in and take advantage of that. That's just how entrepreneurship works in America. Like, when you see a problem, even a social issues problem, people going to come in and take advantage of that and reap money off of that. But that doesn't take away from the actual root cause of the issue that, you know, hey, COVID is a real thing.
Social distancing was not based on anything. How can you not expect people to question these higher institutions that are deemed to look out for the well-being of people, and they don't?
So as stated, and this came out in 2024, so last year, it's true the scientists now know that SARS-CoV-2, the virus that causes COVID, spreads through a mixture of large and small droplets, including extremely tiny airborne droplets called aerosol that could travel further than 6 feet. And the 6-foot rule was never really characterized as a precise threshold for stopping exposure to virus, but the notion that distance was not based on any science is simply not accurate. The risk of contracting SARS-CoV-2 from an infected person drops the further one is from a person because the concentration of virus gets diluted by the surrounding air. And like many respiratory viruses, SARS-CoV-2 can also be spread by larger droplets from cough or sneezes. These drops tend to fall to the ground relatively quick, and 6 feet of distance was widely seen by experts as a reasonable benchmark for avoiding the type of exposure, a recommendation that was fairly easy to remember and estimate by the eye. So when we make public health estimates, it may not be scientifically sound, but there's also common sense with that. And so at the end of the day, the further you're away from a person decreases your chances of getting getting sick from a person. 6 feet is the common sense measure that you can be able to separate while you're in public. If you got to do essential stuff like go to the store or pick up groceries, go out to eat, whatever. 6 feet is the maximum, is the most common sense. It is not possible for people to be able to be 10 feet away from each other while being in public. It's hard to even do 6 feet. 6 feet is just a measure, just making sure, okay, so just trying to get the world back open. Now, there's big qualms about that in the public health department about communications beyond that and just how do we communicate about that. I have issues with, trust me, but 6 feet by itself is not too scientifically off of just saying it's unreasonable. Now, when it comes to how it was communicated, not only just 6 feet, but like how the vaccine was communicated, saying that, hey, if you take this, you know, you're going to end up being dizzy, you're going to end suffering, we're going to get open in the summer. I believe Biden said that in the spring once the vaccine started becoming widely available and he transitioned to office. But that was never going to happen. The administration definitely kind of just was overzealous with that. I will say that.
First, bodily autonomy. I believe that, and that is the sole principle by which we practice medicine. Vaccines fall in a unique category because your decision on vaccinating your child and then sending them to school can impact other children in that school. So much like drinking and driving as an example, your choice to do that puts your life at risk, but it also puts others at risk. So we deem that as dangerous for the general public.
I can't believe you're shaking his head on that. But here's my thing with public health measures. Public health measures do not care about bodily autonomy or independence. This is more so to protect the public. And they have specific exceptions when it's considered a public health measure, just such as, you know, the lockdowns, the 6 feet apart, as well as the vaccine mandates. When your decisions not only just affect you, but affects other people, i.e. getting a vaccine for an infectious disease that has been proven to prevent the spread of it, or at least prevent the, you know, intensity of the symptoms you have from it, then that doesn't care about bodily autonomy and it overrides your bodily autonomy. For example, he put for drunk driving, the same thing with seatbelts. A lot of people were up in arms when seatbelts first came out. Watch on YouTube, see the videos of it. People were literally going, you know, about to fight the reporter because they had to now wear seatbelts, and a lot of people were citing, oh, this is my personal freedom. Like, you can't tell me what to do in my own car. You can't tell me what to do in, you know, at a stoplight, stop sign, whatever. You're not going to tell me what to do. And now everybody wore seatbelts because it was proven that it protected people from when they got into car accidents. And overall, it just makes sure it provides a better public good overall.
The Kissinger report, it's all about pretty much reducing the population of the planet. So I don't know how you can make this claim and really defend vaccines in nature, in the world that we're living in, where we are actually going away from nature. And the further we get away from nature, the more diseases we will see. So, you know, I'm very passionate about this, and I want to be able to have like a real discussion with you because, Yes, you're a medical doctor, but this is also a system that J.D. Rockefeller started, getting rid of all types of indigenous practices, and this land is stolen land. So when we're not even honoring the source, when we're not honoring the land, the ancestors, ancestral intelligence, the real AI, when we're not even honoring
the real AI,
and
what?
we're just supposed to trust science. No, I trust my scientists. I trust Dr. Sebi. I trust Dr. Aris Latham. I trust Dr. Yaki. Because this system is not for us. It's not built for
we need to.
Like
I don't have no idea who they are, y'all.
Because even the opioid crisis, we saw a lot of Caucasians suffering from that.
Yeah,
so
that's
how
true,
can you sit here and say that this vaccine is killing people when this system is currently killing people? When we even have to have an administration that comes in now and says,
yeah, we gonna have to edit this out because he's just going off and just talk about stuff. But we're gonna read the Kissinger report. So the Kissinger report, or otherwise known as the National Security Study Memorandum 200. Implications of worldwide population growth for U.S. security and overseas interest, was studied in December 10, 1974 by the United States National Security Council under the direction of Henry Kissinger. He is bad for all other reasons. I had a video about him. Please go follow that. Following the initial orders from President of the United States, Richard Nixon. And so its contents, basically, it's the thesis of the memo was that population growth in the least developed countries, LDCs, is a concern to U.S. national security because excess population growth that exceeded local food, water, housing, basic infrastructure, and other humanitarian concerns would first cause local suffering that would tend to cause civil unrest and political instability in countries that otherwise had a high potential for economic growth. So from this, I would say the contents of this is not terribly bad. I haven't read it just yet. But from the notion from Wikipedia, if it's just like as bare bones as this, basically it's not too crazy to say that overpopulation does cause civil unrest, because when we have an example in the U.S., we talking about urban centers as well as rural populations. Now, rural populations, they don't have an abundance of overpopulation really, but they have enough population constraints where the current infrastructure they have, especially when you don't invest in rural populations or forgotten America, it'll cause a lot of strain and a lot of not only just civil unrest, but more so diseases of despair when we find out more of unaliving yourself, substance use, as well as mental health issues. This is not far off when it comes to rural areas. Now, in urban areas, when you have a bunch of overpopulation, it has more likelihood of causing civil unrest, because as social systems and as social infrastructure are not able to keep up with this population growth, as well as you have other social issues such as racism, police brutality, a lot of other things, especially when we saw back in the summer George Floyd and Mike Brown and then Trayvon Martin. That was just a whole slew of combination of things of not just the police, but also just like social systems are not able to keep up with population. Some of that is due to actual overpopulation. Some of that is due to underinvestment. Go figure. But this is not far off, really, at least from the contents of this paper, from what Wikipedia said. This is not far off from, just from the truth and what we've known in public health.
Yes, that child who was even in the hospital under those fluorescent lights, I'm not surprised that they had a seizure before, because this is an environment that is not conducive to life.
I agree with him on that, yo.
On my chest is called an ankh. Y'all replace this. Y'all replaced our cultures.
I don't know about all that, y'all.
This life represents.
But I do see where he's coming from.
Death culture. This is not a healthcare system. It's a sick care system. And honestly, I cannot sit here in good faith and not represent all of the people who have come before me.
Fair enough.
Yeah, absolutely. Okay. I respect that. I came to the United States as an immigrant living on welfare. So I got put into this same system that you're describing. It's a shitty system. The world is changing in ways that make our lives more unhealthy. We're eating more processed food. We're exposed to more chemicals. Usually as a result of products that we actually enjoy. So when I complimented you on that great jacket, when someone wears a specific pretty strap on their Apple Watch, there's chemicals in there. There's forever chemicals in there. So for every amazing thing that we have in society, there's been drawbacks. The good part about our society is that we're constantly monitoring those drawbacks and are trying to create solutions for our own problems.
A lot of politics, policies, public health work, was a need to better invest in a public health workforce that can prevent a lot of these issues that he's talking about: chronic disease, infectious disease, just more so processed food, nutrition, like there was a shift towards it before this new administration or old administration coming back. And so what Dr. Mike is saying, that while we're not perfect, we're obviously not perfect. I have issues with the healthcare system. You know, I'm currently going through a billing crisis right now with one of my primary care providers. But at the end of the day, it's not. I'll be remiss to say that no good is happening, or at least some people are not trying to make the good come out of it.
Struck me about your statement about body autonomy and children and the COVID vaccination. What would you say if I told you I had 3 daughters and my spouse and I had differing opinions on whether our children should be vaccinated with the COVID vaccine? And a judge orders that vaccine be injected into my daughters. I'll give you a little bit of data first.
Okay,
And
give me the
was part
data.
of
Give
my
me the data.
reasoning with the courts. Risk versus benefit, correct?
Fair enough.
From 2018 to 2023, if we trust the CDC, their numbers say the most deadly thing for our children, the number one deadly thing, do you happen to know
Probably
what
car
it
accidents
is?
or unalivings.
Accidents. Not necessarily guns, but accidents. Do you know what the number 2? And I'm going from children from 10 to 14 during the height of the pandemic.
Okay, this checks out, yeah.
Pandemic as
A
well.
little bit before, so the numbers are a little bit bigger. The number 2 cause, suicide. Do you know where COVID is on that range of dangers?
Very low.
Very low. That population is about 21 million children in the United States between 2018 and 2023. There were about 4,000 to 7,000 accidents, about 1,000 suicides. Do you know how many deaths there were from COVID?
No, not offhand.
69. In New Jersey,
Okay, even San has just fact checked them. CDC reports 204 deaths from or unalivings from COVID from children ages 10 to 14, not 69. So even when we don't even have to account for just the 2 years that's unalivings and accidents have over Rovid, because they probably will still outlast Rovid regardless. But just looking from 2020 to 2023, that's still a significant and preventable statistic. That's what people don't get about Rovid. Yes, not a lot of people are unalive by Rovid. Not a lot of people are having long-term effects. Well, I can't really say the long COVID and long-term effects because it's still being studied right now. A lot of people are still having those symptoms even after they're cured. But even without having those, like the long-term effect of being unalive, this is still a preventable disease that should not be happening. We have a vaccine. We have medical treatments to prevent this. That is why people are still making it a big deal about it, because this stuff is preventable. Same thing with measles. Yes, if you go with just the argument that, there's measles outbreak every year, RFK said this is normal, or RFK said, measles might give you long-term health benefits, which it doesn't. But anywho, if you believe all that, you have to understand we have medicine. We have a vaccine that has been effective for years, decades, that prevents this. You should not be having your kids go through life without getting vaccinated because you want them to get national immunity when we have an actual medicine that can prevent them from going through all that suffering. So that's the whole argument with Rovid. We don't care about it not being, unaliving as many people as mental health, as well as accidents, as well as, leaving your gun unattended. We don't care about all that. But what we care about, that this is actually preventable. This is preventable.
Of 2020 to July of 2021.
Okay.
The VAERS database, which is the only database we have, there were 14,000 post-COVID vaccination deaths. So how, if you're looking at risk towards benefit, is injecting a child upholding what we call the Hippocratic Oath?
VAERS is unverifiable. Anybody can submit a VAERS report. I can submit a VAERS report. My 10-year-old cousin can submit a VAERS report and ain't got no idea what science and vaccine means. VAERS is not a verified data point. So when he put the 19 or 14,000, whatever they show the number of, unalivings that happened post COVID-19 or COVID-19 vaccinations, whatever number of unalivings that happened after getting the COVID vaccine, correlation does not equal causation. Like literally anything can happen outside of getting the vaccination. If it happens right after you get the vaccination, that'll be more skeptical. But you cannot verify timelines. You can't not verify other causes. It takes a medical professional or coroner to go in, verify what actually happened, and that can't get verified back in the VAERS. It is a self-reporting system, y'all. Anybody can submit to it. So the data is not only faulty, but also too, life happens, heart attacks happens, strokes happen for a number of reasons outside of vaccinations, stress, poor lifestyle decisions, nature. Like it's one of those things where this is not a sound argument, and his fear and understanding comes from a good place, because at the end of the day, no one likes a court coming in and telling you what to do. I oftentimes don't think mandates should be submitted by courts, because mandates, I'm not saying they don't work, but what I'm saying is that's not the best way as public health professionals, the first line of defense that we should use to get people to submit to a public health, order. We need to engage the public. We need to educate the public. We need to get them to understand and get more uptick like that, instead of just getting a court to come in, forcing people to do it. And then, people are starting having an uproar, like we seen during the protests at the beginning of the pandizzy. So what I'm saying is he's not invalidated. I'm not trying to say all that, but his data is faulty, or where he did his research is faulty. And this is why it's important you listen to professionals and not just do your own research and just go call it a day with that. Please ask questions to your professionals. Please ask questions to your doctors. Get them the understanding of what they think on their opinions, and come to your own opinion at that point.
Are you familiar with how the VAERS database works?
I am.
Do you know who can report to the VAERS database?
It's a voluntary report system, so it's open. It's open, either to patients, medical providers,
loved ones, anyone.
Exactly.
During a heated political time, during which people are very angry and are reporting things that do happen during a pandemic, isn't it possible that there's people reporting things that after we look at it and judge it off of the VAERS system, that it is in fact not shown to be causative, but in fact a coincidence or correlation?
Correlation don't equal causation,
I would say
y'all.
that correlation doesn't equal causation.
He answered his own question.
I'll give you another data point to chew on. When I was a law enforcement officer, I saw people that were dying, and then when they were assessing the cause of death, they had a range of other morbidities. And just because they died with COVID, they didn't die from COVID.
Yeah.
But getting back to the children, none of them did.
I think
so he just answered his own questions even after the fact. Like he just said, oh, other people unalive due to another range of comorbidities. And you don't think that would be sound enough to think that this might happen even after someone taking a vaccination? I don't know. I'm trying to give this guy a benefit of the doubt. And like I say, you engage with the public in a more understanding manner and just try to empathize with them. But also, when you come to your own conclusions at this point, or and the dots are not connecting, I don't know what to tell you about the logic. But with that, we're going to pause there. This is a long video. If you want me to do a longer part and finish the rest of it, please let me know. Like, subscribe, comment down below. That might be out by the end of the week, depending on the feedback. But other than that, stay warm, stay frosty, depending on what part of the country you're in. Please watch this other video about Nika Diwa, about parent blogging, and while I'm more skeptical about her vlogging. But other than that, y'all have a good night. Peace out.